All right, let's turn to the pandemic here in Maryland. Fewer than 2,000 people being treated for COVID in hospitals, and that positivity rate now below 11%. The state reporting just over 3,000 new cases today. Obviously, some of the metrics heading in the right direction, but it's not all good news. January set to be the deadliest month here in Maryland since the pandemic began. Tonight, Rachel Cardin has much more on the Omicron variant, really, Rachel, which is leading this current surge.
That's right, Rick, and many people saying they don't want to get hopeful just yet, even though they feel as though Omicron is moving out of the area. They are worried about other variants that could emerge.
And a professor at
Johns Hopkins University's Coronavirus Resource Center acknowledged that January is set to be the deadliest month in Maryland since the onset of the pandemic. That's with 10 billion doses of vaccine administered worldwide and 70% of eligible Americans boosted.
These are fantastic vaccines, but with the waning antibody levels and then the new variants, they have not sustained as high a level of protection, particularly against infection going forward.
But here's why. Omicron was so contagious, it infected more people than any other variant. So more people were sick. As a result, more died, something everyone is worried about.
Omicron is much catchier than the Delta virus. It affects people in different ways.
In a few weeks' time, Omicron swept across the nation, but as quickly as it came, it seems to be going.
As fast as we saw this big surge of cases, we're seeing the same kind of speed as we're seeing Omicron leave the regions. Hospitalizations are also starting to turn that corner.
Maryland residents like Don Joynt aren't ready to let their guard down yet.
It's not over yet. Give it a few months.
He thinks we still have some time with Omicron in our midst.
One of my best friends who's 50 years old just got it 2 days ago. All 3 of her children have it. I got it a month ago. I'm twice vaxxed. I've got my booster.
An Omicron-specific vaccine is being worked on by Pfizer, Moderna, and Johnson & Johnson, but health officials say it'll take several more months to be approved, and by then, this wave will be over. Now, there is talk of a pan-COVID vaccine, which would be a vaccine that would protect you against multiple variants. But according to healthcare professionals that spoke today at Johns Hopkins University, it could take a very long time to develop that vaccine. Of course, then it has to go through the approval process, so it will be quite some time before we see it. In Baltimore, I'm Rachel Cardin for CBS News, Baltimore.